Hello, my name is Mark Timlin and I'd like to give you a brief update of the COVID-19 situation for the South Pacific and Australia region as of April the 18th. So in Australia, the cases have gone up over the last couple of weeks. These are the cases of the COVID-19 from 5,000 to over 6,500. And still it's a relatively low number of deaths at 66 as of today. What is encouraging is that community transition or transmission is slowing down. The health system is coping, people are staying at home, and I guess the other observation is there is an increasing concern on mental health issues. The Sydney Church that had 20 members affected with coronavirus, they're all now healthy, and the good news is that there are no new cases. There's no other reported cases across the partnering churches, which is great news. It is encouraging to see members of the churches supporting each other, supporting the communities. Talking to the Hope reps, they're active in the community and started some activities, specifically the campus students and professionals supporting seniors with groceries. They're starting to organise games like bingo online, also sending postcards, and doing new initiatives like Uber Eats, sending an Uber Eat to a stranger. Moving over to New Zealand, the cases have gone up from 800 people over the last 2 weeks to about 1,500 cases, and again, fortunately, only 11 people have died. So talking to Duncan Wilson, half a dozen people in our church there, the Church of Christ, are working as health workers. One is currently sick, so we're hoping that they're not infected with coronavirus, so we're waiting for the result there. There's ongoing community support, members of the congregation are supporting the local food bank, again to help with food security for the vulnerable. In Fiji, there have been a handful of cases. So again, in the last couple of weeks, that's gone up from 7 to 17, and amazingly no deaths. I was talking to Alex from Suva and also Laite from Nadi, and the economy there has been absolutely devastated. And so specifically towards Nadi, which heavily relies on tourism, there have been many job losses. All the hotels are closed, and this is the first time in history that this has happened. The Fiji government has very little or no provision to help those in need, and actually people have been asked to draw into their savings, their investments. They have something, I guess, like a government sort of scheme where you invest money. It might be similar to what we have as a super, and so they're actually drawing on those funds now to actually survive. The Hope reps have set up a benevolent working group in Nadi and Suva, together with the Churches of Christ, to look at how they can meet the needs of the congregations as well as the wider community. What is encouraging is that members of the congregation are driving around, they're giving out seedlings, so again encouraging people to start to grow their own food. People do have provision now, but in the coming weeks and months, money will dry out very quickly, and that's the concern, that there'll be destitution and poverty, which will be widespread if there's not provision to meet their needs. Moving over to Papua New Guinea, cases of coronavirus were sitting at 1 for a while, and that's shot up just in the last couple of weeks to 7. So it is a concern that there are hidden cases because the amount of testing is actually quite minimal. I was talking to Felix today, and he leads the Port Moresby Church of Christ, and he said that people are finding it tough to be isolated. It's something that it's a new concept. It's something that people are not familiar with, and social gathering, face-to-face interaction is very much part of the culture. And so the limit now is 4 people per group, and people are doing that, but also others not. So it's a sort of a challenging area. Also, connecting via technology has been very challenging because mobile data is limited, but also the cost is often prohibitive to many people. They just can't afford those costs. The other challenge is lack of, or there's no public transport, and again, maybe 80% of the population rely on services like buses, and so they're again not available. And so for those who are more remote, it's challenging. People have been affected. There's been clinics closed, job losses, specifically in the informal sector. Again, there's been limits on ability to work, and the government also has very little capacity to support those in need. Talking to Priscilla, who's the Hope Country Director, she says that the clinics there, so 2 clinics that have been selected to act as the front line for the COVID-19 screening and treatment. So they're, all the staff are actually prepared, they have their training, they've got their tents set up. The thing that's lacking is the personal protective equipment. So they're reusing masks, they've only got like 5 gowns between a staff of maybe 20 or 30. And so that's some of the challenge. And so even in the hospitals, in the main general hospital, there's been lack of equipment there as well, and even nurses resigning because they're fearful of becoming sick. Hope also has been making requests from supermarkets to help with the food security, to be able to give out food hampers to the vulnerable. From Hope Australia, we've managed to purchase personal protective equipment. So we've currently got 7,000 gloves, 2,000 masks, and smaller quantities of goggles, gowns, hand sanitizers, and even hair netting, because one of the interesting things in PNG is the hair is quite widespread, so having that, and the virus can live on the hair for a long period of time, so having those as well is very important. And so we've got 2 consignments, one on the way from Hong Kong, so there's been a bit of a delay there, and there's also a second consignment in Melbourne. And I do want to take this opportunity to thank Fay Lee Smith, who's managed to negotiate with the Australian government to get all the stock that we've secured in Melbourne over to Papua New Guinea for free. So please be praying for the situation. I think we're in a situation of strength in Australia and New Zealand, so please be praying the situation in Fiji and Papua New Guinea can improve, that especially the supplies of personal protection equipment will reach to Papua New Guinea where it's needed in a timely manner. Thanks for your support, and if you would like to donate specifically for Papua New Guinea and Fiji and the ongoing needs there, please visit hopeworldwide.org.au. On the donate page, click on the Give Now button and just put COVID-19. Thanks for listening.